Subscribe for daily quizzes and let me know how many you got correct today. Here's some tropical diseases trivia. What disease is transmitted by mosquitoes? A. Lyme disease or dengue fever, or C. Ebola virus, or D. Malaria? The correct answer is D. Malaria. Which disease causes severe muscle pain? A. Flu virus, or B. Dengue fever, or C. Chickenpox, or D. Lyme disease? The correct answer is B. Dengue fever. What is the vector for Zika virus? A. Houseflies, or B. Aedes mosquitoes, or C. Ticks, or D. House mosquitoes? The correct answer is B. Aedes mosquitoes. Which tropical disease involves schistosomes? A. Malaria, or B. Dengue fever, or C. Typhoid fever, or D. Schistosomiasis? The correct answer is D. Schistosomiasis. What infection is caused by Trypanosoma brucei? A. Cholera, or B. Leprosy, or C. Sleeping sickness, or D. Malaria? The correct answer is C. Sleeping sickness. What is the main cause of yellow fever? West Nile virus, or B. Aedes aegypti, or C. Anopheles mosquito, or D. 1920 outbreak? The correct answer is B. Aedes aegypti. Which disease is associated with contaminated water? A. Diabetes, or B. Tuberculosis, malaria, or D. Cholera? The correct answer is D. Cholera. What parasite causes leishmaniasis? A. Plasmodium falciparum, or B. Trypanosoma subris leishmania, or D. Toxoplasma gondii? The correct answer is C. Leishmania. What illness is characterized by a skin rash? A. Diabetes, or B. Chickenpox, or C. Tuberculosis, or D. Zika virus? The correct answer is D. Zika virus. Which virus is primarily transmitted through ticks? A. Lyme disease, or B. HIV virus, or C. West Nile virus, or D. Tick-borne encephalitis? The correct answer is D. Tick-borne encephalitis. What does the acronym NTD stand for? A. National Travel Directory, or B. New Truck Design, or C. Neglected Tropical Disease, or D. Northern Trade Deal? The correct answer is C. Neglected Tropical Disease. Which disease is caused by Toxoplasma gondii? A. Malaria or toxoplasmosis, or C. COVID-19, tuberculosis? The correct answer is B. Toxoplasmosis. Which disease is linked to river blindness? A. Leprosy, or B. Onchocerciasis, or C. Malaria, or D. Zika virus? The correct answer is B. Onchocerciasis. What infection leads to severe hemorrhagic fever? A. Ebola, or B. Zika virus, or C. Dengue fever, or D. Typhoid fever? The correct answer is A. Ebola. Which virus is prominent in tropical Africa? A. Zika virus, or B. West Nile virus, or C. Lassa fever, or D. Ebola virus? The correct answer is C. Lassa fever. Which pathogen affects primarily the liver? A. HIV, or B. Ebola, or C. Hepatitis A, or influenza? The correct answer is C. Hepatitis A. What parasitic disease often leads to anemia? A. Hookworm, or B. Syphilis, or C. Malaria, or D. Cholera? The correct answer is A. Hookworm. What infection is associated with bat exposure? A. Leptospirosis, or B. Rabies, or C. Hantavirus, or D. Histoplasmosis? The correct answer is B. Rabies. Which mosquito-borne illness has a vaccine? A. Yellow fever, or B. West Nile virus, or C. Dengue fever, or D. Malaria? The correct answer is A. Yellow fever. Which parasite is known for causing elephantiasis? A. Scarus lumbricoides, or B. Schistosoma mansoni, or C. Plasmodium falciparum, or D. Wuchereria bancrofti? The correct answer is D. Wuchereria bancrofti. What type of tick-borne illness is prevalent in Africa? A. Malaria, or B. Dengue fever, or C. Rickettsiosis, or D. Lyme disease? The correct answer is C. Rickettsiosis. What is the causative agent of rabies? A. Ebola virus, or rabies virus, or C. HIV virus, or D. Zika virus? The correct answer is B. Rabies virus. What dangerous disease is associated with fruit bats? A. Nipah virus, or B. West Nile virus, or C. Hantavirus, or D. Ebola virus? The correct answer is A. Nipah virus. What infection can cause swelling in lymph nodes? A. Salmonella infection, or B. Syphilis, or C. Tuberculosis, or D. Filariasis? The correct answer is D. Filariasis. What is a common cause of traveler's diarrhea? The possible answers are A. Norovirus infection, or B. Influenza virus, or C. E. coli, or D. Salmonella bacteria? The correct answer is C. E. coli. What disease is characterized by swollen feet? A. Lyme disease, or B. Gout, or C. Lymphatic filariasis, or D. Diabetes mellitus? The correct answer is C. Lymphatic filariasis. What tropical virus can cause microcephaly? A. Zika, or chikungunya virus, or C. Dengue fever, or D. West Nile virus? The correct answer is A. Zika. What disease causes rashes and severe joint pain? A. Arthritis, or B. Lupus, or C. Psoriasis, or D. Chikungunya? The correct answer is D. Chikungunya. Which virus causes a disease similar to influenza? A. Rabies virus, or dengue virus, or C. Ebola virus, or D. Zika virus? The correct answer is B. Dengue virus. What is the primary vector for malaria? A. Anopheles mosquitoes, or B. Houseflies, or C. Cockroaches, or D. Ticks? The correct answer is A. Anopheles mosquitoes. What is the transmission route for hepatitis A? A. Fecal oral, or B. Sexual contact, or C. Airborne droplets, or D. Blood transfusion? The correct answer is A. Fecal oral. What disease affects the central nervous system? A. Alzheimer's disease, or B. Neurocysticercosis, or C. Chickenpox, or D. Hepatitis B? The correct answer is B. Neurocysticercosis. Which protozoan causes amoebic dysentery? A. Trypanosoma brucei, or B. Plasmodium falciparum, or C. Entamoeba histolytica, or D. Giardia lamblia? The correct answer is C. Entamoeba histolytica. What disease is prevalent in areas of poor sanitation? A. Typhoid fever, or B. Cholera, or C. Diabetes, or D. Ascariasis? The correct answer is D. Ascariasis. What is a common disease associated with undercooked fish? A. Vibrio infection, or B. Anisakiasis, or C. Red tide, or D. Scombroid poisoning? The correct answer is B. Anisakiasis. What microorganism is responsible for river blindness? A. Onchocerca, or B. Streptococcus, or C. E. coli, or D. Aspergillus? The correct answer is A, onchocerca. What disease is linked to unsafe blood transfusions? A, malaria, or B, syphilis, or C, HIV/AIDS, or D, hepatitis C? The correct answer is C, HIV/AIDS. What microorganism causes visceral leishmaniasis? A, schistosoma mansoni, or B, Plasmodium falciparum, or C, Trypanosoma brucei, or D, Leishmania donovani? The correct answer is D, Leishmania donovani. Which parasitic infection is often asymptomatic? Hookworm, or malaria, or C, giardiasis, or D, schistosomiasis? The correct answer is C, giardiasis. Thanks for watching. Comment with how many questions you got correct. Should we make the next video have easier or harder problems? Was the difficulty just right? Do you have suggestions for future trivia topics? Don't forget to drop a like and sub if you enjoyed the video.